Okay, so in this video, we're going to go over some manual muscle testing. And to do that, we're going to do a bunch of break tests on a bunch of different joints. And so what a break test is you put a joint in a strong position and you tell the patient to hold it there as strongly as they can, and you try to break them. You try to overcome the amount of strength to test the strength of their joint. So the first one we're going to do is we're going to test the extensor hallucis longus, which is the muscle that pulls the big toe up. So what I'm going to do is I'm going to have her push that toe down just a little, pull that toe up into extension just a little bit. And I'm going to tell her to hold it there as hard as she can. I'm going to stabilize above the joint. I'm going to grab the appendage and I'm going to try to break it. Okay, so are you ready?
Yeah.
Going to hold it in a little bit of extension. I'm going to try to break it. Good. She had good strength on that one. We're going to test bilaterally, so I'm going to have her do it on the other foot. We'll let a little bit of extension. Don't let me break it. Good. She had good strength on that one too. The next one we're going to do is the tibialis anterior, which dorsiflexes the leg or the foot. And you can do this one seated as well. What I'm going to do is I'm going to have her put her foot in a little bit of dorsiflexion. I'm going to stabilize above, and I'm going to push her foot down. Don't let me break you. Good. Very good. Very good strength. Now we're going to do it on this one again. Don't let me break you. Good. The next one we're going to do is we're going to do the gastrocnemius. Now, there's a couple ways you can do it. You can do it sitting, or you can do it with them prone and have their leg flexed. Actually, with the gastroc, we're going to want the knee to be extended. And so for this one, you can have her knee up here, or you can have her lay down with just her foot hanging off the edge of the table. So I'm going to put her in a little bit of plantar flexion, stabilize above. Don't let me break you.
Where am I supposed to go?
I'm going to be pushing you up. Don't let me break you. Ready? Good. And it's important that we have this knee straight, or else it's going to be all soleus doing the work, and we're not going to be able to test the gastroc. Don't let me break you. Good. Now we have the peroneal longus or the fibularis longus muscles, which evert the foot here. They kind of pull the foot out this way. And so what I'm going to do is I'm going to have her evert her foot a little bit. I'm going to stabilize above. Hold your foot right there. I'm going to push you in. Don't let me break you. Good. Now I'm going to do it on the other side. Don't let me break you. Good. Now we're going to do the tibialis posterior, which is another plantar flexor of the foot. And it also does inversion. So just the opposite motion of that. We're going to slightly plantar flex and we're going to invert that foot. And I'm going to pull it out and she's going to try to resist me. So don't let me pull. Good. I'm going to do it bilaterally. Good. Now we're going to go on to the quadriceps, and you can be seated for this one as well. This one's pretty simple. I'm going to stabilize up here. I'm going to have her straighten a little bit, and I'm trying to bend her knee, and she's got to resist me. You ready? Good.
You're using all your muscle?
Yeah. I'll do it bilaterally. Don't let me break you. Good. Alright, now the last one we're going to do is we're going to do the hamstring muscles. So to do this, again, you can lie down and try to break them that way, or you can just have them seated here because their knee's already bent. So what I'm going to do is I'm going to stabilize up here, and I'm going to try to extend her leg, and she's going to resist me. Ready? Good. Same thing on this side. Good. And those were a few examples of some manual muscle testing brake tests.